Diabetes Medical Management Plan, or DMMP. The school nurse, when available, is the most appropriate person in the school setting to provide care for students with diabetes. However, many schools do not have full-time nurses. Even for schools that do, the nurse may not always be available during the school day, during school-sponsored extracurricular activities, or field trips to assist with routine care and emergency care. Trained school personnel must be available to perform and assist the student with diabetes care tasks. This presentation is not intended to provide legal or healthcare advice. Please consult with a legal or healthcare professional regarding your specific questions and needs. This training component was created specifically for school nurses and other qualified healthcare professionals to train non-medical school personnel. This unit is Diabetes Medical Management Plan, also known as the DMMP. Participants will be able to understand why the Diabetes Medical Management Plan is important, what kinds of plans are most often used to document diabetes care and accommodations in schools, the purpose, content, and person responsible for each kind of plan, and how the plan works together to ensure that students with diabetes are safe and successful at school and treated equitably. The DMMP is the foundation for the development of all school written plans. The DMMP is the medical basis for an individualized healthcare plan written by the school nurse, a Section 504 accommodations plan or individualized education program, and emergency care plans for hypoglycemia and hyperglycemia. A DMMP should be implemented for every student with diabetes. The DMMP is developed and signed by the student's personal health care team, parent guardian, and the school nurse with specific needs of an individual student in mind. It should detail the elements of care and assistance for that student. Once the DMMP has been provided to the school, it is implemented collaboratively by the school diabetes team, which includes the school nurse, student, parent guardian, and other school personnel. Details regarding how, when, where, and by whom the elements of the DMMP will be implemented should be documented in writing. Many school districts have their own health forums where the school nurse documents information on diabetes care. Additionally, both health and academic accommodations related to diabetes should be included in written education plans for students with disabilities such as diabetes. For example, under Section 504 of the Rehabilitation Act of 1973, students with diabetes are entitled to accommodations to ensure equal access to public education. A 504 plan should be written to document diabetes-related accommodations needed by an individual student. Some students with diabetes will also be eligible for special education. For these students, diabetes care needs should be documented in the individualized education program that is required by another federal law, the Individuals with Disabilities Education Act. Information and a sample DMMP and 504 plan can be found on the ADA's website as follows: DMMP at diabetes.org/DMMP and 504 plan at diabetes.org/504 plan. The DMMP should include the following information: emergency contact information, meal and snack schedule, necessary supplies or disaster planning for extended field trips, self-management skills, blood glucose monitoring including CGM, insulin medication or administration, low glucose prevention and management, physical activity and sports, glucagon administration, high glucose management, and physical activity and sports. The Dmmp, which will be different for each student, specifies the dosage, delivery system, and schedule for blood glucose monitoring, insulin medication administration, glucagon administration, ketone monitoring, meals and snacks, and physical activity. The ADA Dmmp will be reviewed in the following slides. The table of contents serves as a quick guide for finding critical information and guiding parents and providers in their respective roles. The top of page 1 includes a student photo area to assist with confirming the student's identity. The header and footer of the form, once completed, will replicate on every page and will include student and provider name and contact information. The first demographics section contains details about the student's contact information, arrival, and dismissal from school. It also describes important information about meals at school and meal timing, as well as physical activities the student is participating in. It is suggested that the parent-guardian complete this section before the provider completes the rest of the plan. Section 2 assists families in preparedness at school by guiding them through a list of important supplies the student must have access to at school in order to implement the Dmmp plan in routine and unanticipated circumstances. All students wearing insulin pumps must have access to injectable insulin, and all students wearing sensors must have access to the BG testing via fingerstick. All students on insulin need access to glucagon and ketone testing at school. The new fillable Dmmp will also populate important provider contact information onto each page, facilitating completion of the form. In Section 3, parents indicate the student's level of independence at home and, in collaboration with the healthcare provider, will list the appropriate level of independence at school. Full support, supervision, self-care are defined on the slide. School staff can often serve as an important support system for students with inconsistent diabetes self-care practices that are not achieving their glucose goals. This section also includes use of a smartphone if the student is self-carrying diabetes supplies. Section 4 allows the student and family to provide important signs and symptoms that the student typically exhibits with high and low blood sugars, allowing school personnel to identify the potential need for emergency care. In addition, this section includes the history of glucagon use and diabetic ketoacidosis, or DKA. Section 5 provides the method, frequency, and timing of glucose monitoring. This section includes CGM information, the brand and alarm parameters. This section also includes finger stick checks and parent notifications for lows and highs. Sections 6 through 9 must be completed by the healthcare provider. This section describes the manner in which the student receives insulin and whether they utilize a bolus calculator for dosing. Timing of insulin administration is an important consideration for students that are inconsistent eaters. This section allows students to provide partial boluses prior to meals, thereby avoiding after-meal hyperglycemia. It also offers the opportunity for school staff to transition students to pre-meal dosing when students demonstrate consistent eating or can consistently anticipate partial meals. It also provides guidance for rounding of whole and half units. Section 6 goes on to include supplemental orders to include ketone testing and parent adjustment of insulin. Many parents learn to adjust insulin as appropriate. This section authorizes parents to do so without needing new orders completed by the healthcare provider. Section 6A is the dosing table for insulin administration. This section includes the type of insulin the student is on and their current dosing schedule. It also allows for adjustments for physical activity. This page can also serve as a single-page update for any dosing changes made at subsequent provider visits. Section 6B allows for correction dosing using the sliding scale method. An important addition to the dosing table includes a section for long-acting insulin and other diabetes-related medications, such as metformin in Section 6D. These areas can be used to document doses administered at school as well as after hours, making them useful for overnight field trips or in the event of emergency or natural disaster. An area for provider signature and date is provided to allow the dosing page to be used as a single-page update for changes made during the school year. Section 7 is all about hypoglycemia prevention. The safety of students is of paramount importance at school. The advent of sensors and automated insulin delivery systems, or AIDs, make it easier than ever to minimize the frequency and severity of hypoglycemia at school, facilitating our students living with diabetes to attend instruction and physical activities without interruption. Trending arrows and continuous readings offer a unique opportunity to prevent hypoglycemia by using small amounts of carbohydrate in advance of actual hypoglycemia and/or reducing basal insulin. Additionally, this section allows for prevention of lows related to exercise. Prevention through reducing insulin delivery and/or snacking can allow the student to engage in physical activity without hypoglycemia or interruptions. Section 8 provides instructions for low glucose management and treatment of severe hypoglycemia through use of glucagon or glucagon-like products. Although set thresholds and quantities of carbohydrate to treat hypoglycemia are available as defaults, this is an important place to tailor the treatment to the student. In addition, guidance for new formulations of glucagon is also offered, as well as instructions for their use. Section 9, the high glucose management section, provides individualized thresholds for hyperglycemia management, allowing for modifications of the default thresholds of 300 milligrams per deciliter for students using multiple daily injections and 250 milligrams per deciliter for those using insulin pump therapy. It provides more guidance for the school nurse regarding when it is appropriate to return the student to the classroom or physical activity, when ketone testing and correction insulin by injection is needed, and provides guidance for follow-up evaluation of the student. This section also includes a checkbox to allow schools to communicate school health records to the student's HCP for evaluation and potential adjustment of current orders. Individual school district policies may require additional paperwork to be completed for this request. The final signature page ensures review and approval from all parties: healthcare provider, families, and school staff. The 504 plan IEP or other written accommodations plan should address accommodations needed for both routine and non-routine school activities and settings, even for relatively infrequent events like standardized testing or overnight field trips. Listed on the slide are examples of the types of things that might be addressed. Anticipating such events and proactively addressing them when the plan is written will not only ensure the student's safety and full participation, but also help to avoid misunderstanding and potential conflict between the school, family, and/or healthcare providers. A sample 504 plan can be accessed on the ADA's website at www.diabetes.org/504plan. The IHP developed by the school nurse documents and communicates the individual student's needs and the school's diabetes management strategies for the student in the school setting and is based on the medical orders found in the Dmmp. Some school districts may have their own healthcare plans and forms. The school health team members work together to implement the diabetes medical management plan developed by the student's personal diabetes healthcare team, often using the strategies outlined by the school nurse in the IHP. The IHP communicates the diabetes management strategies for the student in the school setting. The emergency care plans for hypoglycemia and hyperglycemia summarize how to recognize and treat hypoglycemia and hyperglycemia. Based on information from the student's Dmmp, developed by school nurse with input from parent guardian, and distributed to all personnel who have responsibility for a student with diabetes. These plans may be found on the ADA's website at diabetes.org/SAS training and in ADA's school guide at diabetes.org/SAS guide. How the Dmmp will be implemented should be documented in a written accommodations plan, such as Section 504 plan or individualized education program, and should also be included in the individualized healthcare plan. A Section 504 plan is a written plan developed for students who are eligible for services under Section 504 of the Rehabilitation Act of 1973. An individualized education program is a written plan developed for students who are eligible for services under the Individuals with Disabilities Education Act, or IDEA. These written education plans detail both health and education-related aids, services, accommodations, and any special education services the students may need. The individualized healthcare plan is a care plan developed by the school nurse that communicates the nursing strategies for the student in the school setting in accordance with the student's individualized Dmmp. The emergency care plans for hypoglycemia and hyperglycemia are quick reference plans developed by the school nurse that describes the individual student's symptoms and treatment of hypoglycemia and hyperglycemia. With respect to diabetes care, these written plans implement the Dmmp by addressing issues such as where and when should blood glucose monitoring be allowed, who will be trained to provide care in the absence of licensed medical personnel, who will administer glucagon to a student with severe hypoglycemia, who will administer and/or supervise insulin administration, who will accompany and provide care on field trips at extracurricular activities, and where will equipment, supplies, and medications be kept.